Hi everyone, today we're here with Eileen Trum, who is a registered nurse and certified diabetes care and education specialist. Eileen, could you tell us a little bit about yourself and what services are offered here at the Samaritan Albany Diabetes and Nutrition Outpatient Clinic?
Yes, thanks for asking me to join you today. I've been a certified diabetes and education specialist for about 35 years, and during those years I've worked at Salem Hospital as an inpatient and outpatient educator. I've worked at a high-risk pregnancy clinic for low-income, non-insured pregnant women with diabetes. I've also worked at an endocrinology clinic and have previous work experience in dialysis, cardiac rehab, home health, taking care of patients with diabetic foot ulcers, and I've also worked as a care manager. I think seeing the complications of diabetes firsthand as a nurse is really what's driving my passion and longstanding career to help people with diabetes. And in the last 8 years, I've had the privilege of working here with some terrific dietitians and nurses at Albany General Hospital. I currently work in our outpatient diabetes education clinic, and we also see inpatients who have been admitted to the hospital with diabetes. We provide education to people with type 1 diabetes, type 2 diabetes, prediabetes, and gestational diabetes. We provide education in a group setting or individually along with their support system. We assist with insulin management, medical nutrition therapy, and diabetes self-care management. And we also have a diabetes foot care clinic and provide routine nail care for patients who qualify.
Go over kind of a really commonly asked question, and that is how to manage your diabetes when you get sick. We're kind of coming in out of flu season into allergy season, so we just wanted to discuss a lot of the questions that revolve around this topic. So first of all, how often should we be checking our blood sugar levels when we get sick?
Well, when you're sick, you should certainly check your blood sugars more frequently than you usually do. Even if your blood sugars are usually in good control, it can fluctuate a great deal when you're sick. If you're unable to eat, you can still have very elevated blood sugars in the 200, even 400 range. So it's important to check at least every 2 to 4 hours and to call your diabetes healthcare team if your blood sugars are higher than 240 for more than 6 hours. Test your blood sugars often until you feel better and your blood sugars finally get back to normal.
Question is just around medications and how they're affected. Should we change the amount of medications we're taking?
It's important when you're sick to keep taking your diabetes medication, even if you can't eat. If you can't keep your oral medication down, like due to nausea, vomiting, it's important to call your doctor. They may prescribe something for the nausea and vomiting so you don't get dehydrated, which is often the cause of your high blood sugars. If you take insulin and your blood sugars stay high and or you're spilling ketones with type 1 diabetes, you will need extra insulin. We recommend following the guidelines provided to you by your diabetes healthcare team, or if you don't have those guidelines, call your team members for advice about taking extra insulin. This is often provided as a correction scale with rapid-acting insulin. It's not unusual at all that when you're sick, your insulin requirements will greatly increase. Stress hormones released when you're ill will cause the very high blood sugar levels. So you can really eat nothing for 2 or 3 days and yet have blood sugars that are running in the 2 to 400 range. So it's very important to keep taking your diabetes medication. Don't stop.
Okay, so my next question has to do with ketoacidosis. So are you at higher risk when you have the flu? How serious is this condition? Can you kind of tell us how to monitor it?
Yes, certainly. If you have type 1 diabetes, you are at higher risk for diabetes ketoacidosis when ill. Diabetes ketoacidosis, also known as DKA, can occur quickly and can become very serious, resulting in a hospital admission. With illness, ketones can be present even with lower blood glucose levels, especially if you become dehydrated due to poor oral intake with fluids. Let me explain further. Ketones occur in your blood and urine when you are ill with type 1 diabetes. If there's not enough insulin in your body to use sugar for energy, stored fat is broken down and used. When fat is used for energy instead of the sugar, harmful acids form called ketones. And then these ketones build up in your blood and eventually can spill into the urine. If not treated right away, it can become life threatening.
Okay, and do you have any tips on how we can monitor this?
Well, as far as monitoring, a urine test is used to check for ketones. There's a product at the pharmacy called keto sticks, which you should have on hand to test your urine when ill. We recommend to test ketones if your blood sugars are 250 or higher, if you're sick or have an infection, if you're under a lot of stress, maybe you've lost weight and you really don't know why, or you just don't feel well. Even if your blood sugar's in the normal range, it's recommended to check your urine for ketones. So we tell our patients to call your doctor if your blood sugar is above 240 twice in a row, and there are small, moderate, or large amounts of ketones in your urine. You'll be told what to do and whether to take more insulin.
Okay, so my next question you've kind of touched on already. A lot of times when we're not feeling well, we don't feel like eating or drinking, or we can't keep food down. What are some tips you have for that?
Even so, you do need to continue to eat or drink carbohydrates to prevent low blood sugars and to get good nutrition so you can fight the infection or illness. So we recommend to try to eat or drink about 50 grams of carbs every 3 to 4 hours. You can get 15 grams of carbs from examples such as a half a cup of fruit juice, a half a cup of regular soda pop, a half a cup of Jell-O, a double icicle, half a cup of soup, or 1 cup of sports drinks like Gatorade, toast, soda crackers. 6 soda crackers is a carb serving, half a cup of applesauce, a half a cup of ice cream, or even a half a cup of cooked cereal. These are just some examples, but they're easy to digest and are quickly absorbed to give you nutrition. And the other thing is just to drink lots and lots of fluids, at least a cup or 8 ounces of caffeine-free liquids every hour. If drinking causes you to vomit, you could try sucking on like an icicle, a popsicle. You could try drinking maybe 1 to 2 tablespoons of fluids every 20 minutes. Good choices of fluids include the fruit juice, clear soup, or even the sports drinks. They have a lot of electrolytes and minerals in them. If you vomit more than twice, call your doctor because you are losing important minerals, electrolytes, and fluids. So be prepared and have those types of foods in the pantry that are easily accessible.
Okay, great. So when is that moment when you should definitely call your doctor?
Well, I think it's important to certainly call anytime you have questions or concerns, but definitely call if your blood sugar's low, less than 70 or 80, if you've had high blood sugars that have been going on for more than 6 hours, let's say blood sugar's above 240, 250. If you can't keep food down and you vomited twice, you're already in trouble. So report that. And if you just can't eat or drink for more than 4 hours, let them know that. Another important thing to report is if you're having a fever that's at least 101.5 or higher, the doctor needs to be aware of that. And certainly if your illness lasts more than 24 hours, you have severe pain in your stomach, have chest pain, or just have a hard time breathing, let your doctor know that. And here's an important tip when you do call your doctor's office. You don't get to talk to the nurse or the doctor right away, but there's 3 magic words that may get you help sooner. And that is, I have diabetes and I'm sick. Before you start telling the receptionist all your symptoms, be sure and mention that you have diabetes because that will get their attention quickly and hopefully get you help a lot sooner.
Awesome. Okay, I love those tips. So these next couple questions are just focused more on prevention and preparation. So what can we do, first of all, just to kind of be better prepared for sick days?
Well, I always recommend to have a sick day kit at home, and that's could be a Tupperware container or just a shoebox where you have extra products on hand. When you're sick, you don't want to run out to the pharmacy real quick to get juice cans or soda cans or sports drinks. In a sick day kit, it would look something like maybe a box of Jell-O, crackers, broth, thermometer, keto sticks, the little cans of regular soda, and you could have diet soda as well to drink if your blood sugars are really high. You don't need all the extra sugar. So have some sugar-free products and some regular calorie products such as the juices and the pop and those kinds of things. It might even help to have popsicles in the back of the freezer in case you're sick. And more importantly is just think prevention. It's really important this time of year particularly to make sure you've had your flu shot, your pneumonia vaccine is up to date. Ask your doctor about getting a COVID vaccine and when is that possible. And just be in close contact with your physician, keep your doctor's appointments, and stay in good control. That is probably the best advice I can give you. And if you do get sick, get help very quickly. Seek treatment early. And just one more thing I'd like to mention about over-the-counter products. Be really careful with taking over-the-counter products like aspirin or cough syrup or decongestive medications. They may raise or lower your blood sugar. Your pharmacist is your best friend when it comes to that, to ask, what can I take for my sore throat? Or I have diarrhea, what can I take? Really important to ask those kinds of questions to your pharmacist.
Okay, and on that note, if you do have any further questions regarding what we discussed today, you can reach out to our Samaritan Albany Diabetes and Nutrition Outpatient Clinic. They can be reached by phone at 541-812-4839. Again, that is 541-812-4839. And thank you so much for listening.